My name is Alan Hyde, and tonight we are joined by a special guest, a local licensed clinical social worker in Bedford, Texas, Julie Barksdale. How are you doing?
I'm doing all right. Thank you for having me.
Yeah, thanks for coming on.
Yeah.
Julie specializes and works with not just trauma in EMDR, which we'll get into a little bit here, has some history and background working with addictions, but mostly these days is working and treating trauma with EMDR, and I imagine other various types of trauma treatments,
Right.
including
Yes.
just talk therapy in some of those realms. We're going to break all these things down. We're going to hear Julie's perspectives. But why don't we just kind of start there? How would you describe your work with EMDR to give our listenership just a general outlook of what maybe they would expect if they came in for therapy with you?
Yeah, sure. So if someone were coming in to work with me and had a trauma history or were wanting to address PTSD symptoms, and particularly if they were struggling with really intrusive memories or images or struggling with traumatic reminders, I may suggest EMDR to them. And it's a therapy where we look at both the past, the present, and the future. But what it does is it really helps people in a very safe and contained way face their trauma and work through it and work through all the negative associations with it so that it no longer holds that same charge. And if someone's faced with a reminder, let's say, they're not going to have that same distress level anymore. It would be more like any memory or a more neutral memory.
Yeah. Could you shed some light on, for those who may not know anything about
Sure.
EMDR, what makes it so safe?
So I always let clients know they are in control of the process. So they are in the driver's seat. And so, because understandably, it can be very overwhelming and very scary to work on trauma. And oftentimes, right, there's a lot of avoidance and fear, and even kind of looking at this. And so I'm with the person the whole way. They're in control. And so we can stop at any point. They get to decide where to start. And if they need to stop, we can stop. And also, sorry, I forgot this part, but we also work on making sure that there are some coping skills and grounding skills in place before even getting into the trauma history. So I apologize, I forgot to mention that.
Yeah, no, it's a good call out because I think that's an important thing I've noticed with any professional we've had on the show who works with the MDR is that we're not, much like any therapy, we're not jumping straight into all the interventions right away. There's an intake, there's a process of grounding, right, which we could describe more for those listening in just a moment, but that process of finding more coping strategies, the thresholds for what's too much and where we're dipping our toes in and these kind of things. And I guess that kind of leads to like my next question for your practice in particular is like, what are some of the ways that, because you're practicing virtually, that you're assisting in the grounding in prep for EMDR with a client who's doing that virtually?
Right. So we may go over some of the same exercises as you would in an in-person session, just doing it remotely. So that element would look the same, honestly. And if someone is with the eye movement piece and the name eye movement desensitization and reprocessing, it's a mouthful. There's actually a website that I'll connect people with where they can do the eye movements through their own computer, so I don't have to be there in person with them.
Yeah. I've also heard of the tapping and the different versions. Do you find yourself gravitating to a type that you like with the EMDR work that you do with your clients, or do you let them kind of on their end choose?
we try to start with the eye movements just because that's kind of the most established. It's kind of the original, if you will. But right, sometimes people might have pain with their vision, or it's just not working. So I have had clients who have their own tappers, or say if it gets similar to in person, if it becomes very overwhelming, someone might have, be crying, for example, and then we would switch to call it the butterfly tap that someone can just do, again, in person or virtually, exactly the same.
Yeah, yeah. This is a question I always, when I have access to an EMDR trained therapist, is because you guys always have really good perspectives on this and different answers that I think highlight the benefit of trauma treatment in these realms. But why do you think the bilateral stimulation is so helpful for those who've experienced trauma?
Yeah, I know, there's the different theories out there. One is that it's similar to what happens in REM sleep when we're having a lot of memory processing and consolidation. To me, what makes it so helpful is that it kind of helps the person take a step out of themselves. They're still there, but it helps them keep in that observational space more easily. So they're able to notice their internal experience without becoming either completely overwhelmed by it, or the alternative flip of kind of dissociating, right? Where they're kind of possibly going completely out of body, numbing out, disconnecting. So to me, that's what's so cool about it. And I think that really helps with that, having, while they're holding the trauma in their mind and their body and kind of looking at it, but also having the eye movements or the tapping going on the same time helps contain that and make it more of an observational process, if that makes sense.
Yeah. Well, and you've worked with, populations that are going through some pretty severe traumatic histories just on any given day. I mean, you've worked with veterans and individuals actively serving in the military. Do you find cases that come through where it's going to be either a lot longer before we get to EMDR, or you may not recommend EMDR? Does that ever come up?
Yeah, so kind of depending on the person. I have had, some clients, we get started with it, and for whatever reason, it's just not for them. They're not able to stay present with it. They're just not feeling it, which is, right, that's okay too, right? Thankfully, we have options. So another trauma treatment I'll fairly regularly do with clients is written exposure therapy. And so that has some similarities with EMDR, as all kind of trauma focused therapies do, but also some differences.
Yeah,
of course.
Just for my own excitement and enjoyment in learning things from other clinicians who use modalities I don't use day in and day out, could you explain a little bit of just what a day in the life of a therapist working with a few clients with written exposure therapy might expect to be implementing with clients?
Yeah, sure. So we pick a specific memory to work on, so similar with EMDR. And then it's nice because it's also very structured. So there are 5 writing sessions where someone will spend 30 minutes writing about the traumatic event. And that'll include, what actually happened, their feelings, thoughts around it, kind of how it changed their belief system. So kind of looking at all those pieces, which we also look at with EMDR. And then what I'll do is, since I am working remotely, I'll ask someone to do that right before our session. And then they are able to read it out loud if they're comfortable doing that. So that's yet another way of kind of processing it. And then we can kind of talk through it. But again, similar to EMDR, with facing the memories and kind of working through them in a safe way with support is very healing.
Yeah.
Yeah.
Yeah. I do a lot of family tree work, inner child type of approach. Very similar sound, right? Sim aspects. It's interesting to hear, right? It's like we all kind of converge into these spaces, but it's nice to hear the perspective broken down because for those listening who tune in week to week, listen here, there's just a lot of options.
Yes.
And that's a beauty, I think, of today's day and age with therapy is like there's a lot of options. We all converge into this space of like peace and containment and helping you get grounded in a lot of really brilliant ways to help you get there. So if you're not feeling one thing or the other, we can pivot or find you someone who fits that, or we can implement something different.
Yeah.
That's really nice.
Yeah, exactly. I would say, if you try one thing and it's not working, certainly don't give up because, right, there are many really excellent modalities to help people heal.
Yeah.
Yeah.
What got you into doing all this? Let's learn a little bit about you, Julie. What pulled you in the direction of becoming a therapist and working with people in these ways?
Yeah, so kind of going back, what actually got me interested in social work initially was I started off in school wanting to do a music track, and that didn't work out, which ended up being for the best. But I had a summer job actually. I was one of these people. I was going door to door trying to raise money for an environmental organization.
Okay.
And it was tough, but I found that I really actually liked it. I just kind of liked connecting and talking with all sorts of different people, and I liked kind of working for a cause. But then I was, just kind of reflecting more on what I wanted to do with my life, and that, I care about the environment, but I really want to, support people and kind of work with people. So that got me interested in social work. So I kind of took an introduction class and
Yeah.
just went from there.
Were you doing that in Texas? The door.
Yes.
How was that?
Well, it was in Austin, so
Okay, a little more progressive.
I definitely had a lot of people were very kind and very nice, and then I had the get the hell off my lawn,
Yeah.
as well, which is fine. Like I can't blame them. So
Yeah, sometimes not so dissimilar from being a therapist
yeah,
either.
yeah, exactly.
And then when you became a social worker, you were telling me a little bit beforehand. At some point, you go overseas and you're working with the Army
Yes.
in a therapeutic
Yes.
aspect. How'd that come about?
So I, grown up in Texas, gone to school in Austin. I've been working in Austin in community mental health settings for several years. And I'd always kind of had an interest in working with the military and living overseas. So at one point I thought, why not go for it? So I just kind of started applying to different positions overseas. And then it ended up, I got an offer to work with the Army in South Korea. And yeah, so it was exciting and I went for it.
Yeah. How long were you there?
About 2.5 years.
Yeah.
Yeah.
Any tidbits on people looking to travel to South Korea from someone who spent 2 years there?
It's a very nice place. It's very safe, so I always like to mention that. My story with that is you could go on a train, travel by yourself, and leave your bag or your purse in the seat and go to the restroom, and you have no worries. They do have the CCTV everywhere, so if you're going to commit a crime, you're probably going to get caught. But, it made me feel very safe, which was really nice,
Yeah.
in my opinion.
Is that where some of the EMDR started, or were you already doing some of that prior?
So yeah, I actually got trained right before moving to South Korea. So dipping a toe, I guess, before that. But
Sure.
yeah.
I'm sure it was helpful, finding yourself then working with individuals with Army and military background to have EMDR as an option to work with. 'Cause I can only imagine it came up probably every day in your practice.
It did. So, but at that time, actually, and I think it was starting to shift closer to the end of my time there, but they very much had substance use counseling and mental health counseling separated.
Oh, okay.
So it's kind of interesting. It was at times kind of a stay in your lane, which you can do EMDR with substance use as well. There are
Yeah.
certain ways to use that, but closer to the last period of time I was there, it was starting to blend a little bit more, which I preferred because to me it's kind of hard to separate all this stuff out.
Yeah, we've had multiple substance use professionals where the bulk of the conversation for anybody who's worked with it for any amount of time, we know the root of really when you dive into any addiction and you remove the substance, you're
Yeah.
dealing with all of the muck and the mire of generational traumas, but predominantly like if we just call it trauma, right? And getting in there
Sure.
and sorting out some of those dynamics. But at that time, you were in the addiction side of treatment
Correct.
and then
Yes.
transitioned to trauma
Yes.
treatment predominantly.
Right.
What's the main, I don't want to be insensitive here, but the drug of choice that's popping off with the army in South Korea?
Alcohol, because that's really what's readily
Yeah.
accessible.
Yeah.
Yeah, so that was the primary one for sure.
Yeah. And I imagine at that point, a lot of the assessments are to make sure that they're fit for duty and these kind of things.
Yes.
Yeah.
Yes. That was another piece that was kind of an adjustment, from a social worker, therapist, person first, which still was person first, but you also have to consider the mission essentially is kind of your client, which is kind of, I had to wrap my head around.
Yeah. What's the, I guess the mental gymnastics surrounding some of that? I mean, it's like we're used to adapting and shifting some of the ways we look at these aspects, but social workers do it a lot, right? It's like you could be working for the county and it's all about the dynamics for the kid, right? You're working with the military and it's all about the dynamics of the mission for the military. I guess what I'm getting at with my question is like, what is that process as a social worker of shifting those gears and what you have to prep yourself, to show up and adhere to the professional side of it too for the government, if you will.
Right. I think, it was an acceptance process over time, but also really remembering, safety of the community, the nation, if you will, I mean, truly. And so I think also, though, trying, just like with any sort of mandated treatment or programming, you want to be, crystal clear with the client and make sure they have a full understanding of, hey, which, we try to do, right? Always get you the support so you can get better.
Yeah.
So if you want to stay in the military, you can. But if you don't follow through with, what needs to happen, then there's a chance you may no longer be able to stay in the military. And that's hard.
Yeah. It's a tough, I've had to work with individuals over the years on the back end of that. It's tough.
Mm-hmm.
Yeah. But I think also in a world where we deal with trying to get rid of expectations, it's kind of like these are some of the realms where expectations are going to be a part of it. And I think that's always realm with any first responder or military man I've ever worked with or woman. That's kind of the understanding is like there are certain expectations with those oaths.
Right.
And learning how to navigate within them.
Exactly. Yeah. And usually I think, for the most part, people really, they understood that, so they get it.
Yeah. I imagine too, it's like you're on the other side of the world, you're trying to adjust depending on what you're there working on and then the distraction.
Oh,
right?
yeah.
It's why I asked what substance, because we know this in any place that an individual is deployed is like human beings distract themselves when they feel something is missing. What's a big aspect of being brought to a place of powerlessness around what's missing is a geographical location shift.
Yes.
So I just imagine it's tempting even for those who didn't have an addiction.
Yes. No, it's very challenging. Unlike, I wanted to go overseas. A lot of the soldiers uh, it's their first duty station there, and so they're new to the military. A lot of them are very, just out of high school some of the time. So that, yeah, combination could be really tough. And there's a huge drinking culture in the military too. So
Yeah.
it's one of those kind of strange worlds to live in.
Yeah, it's kind of like sports and military, and there's a lot of aspects like this, but especially with groups of men. It's like you come in at 18, 19 years old, you're technically not legally able to drink, but everybody's doing
Exactly,
it.
right.
So the access is there,
Right.
and that creates a problem if you're under oath somewhere to serve and protect. That could cause a real messy problem real quick. And I had some
Yes.
buddies in high school that happened to, and it's unfortunate because there is recourse and no recourse at the same time for the older gentleman who should be holding, I guess you could say, could be holding a better example. But when you look at it, it's like when you bring it into the place of compassion, it's like everybody has their shortcomings, which is why we bring in the mental health professionals, because it's just too gray of a conversation to slap one answer onto, how should the conduct be? Yeah, it's
Right.
tough.
Yeah.
Then you transition into private practice.
Yes.
When did that happen?
So I moved back from South Korea a few months before the pandemic,
Okay.
actually. And I considered staying, working with the military, but my plan before I got the job in South Korea was if that didn't work out, I was going to try private practice. So just as I had kind of had this interest of working with the military, I also had an interest in trying private practice. And I had done some volunteer work with a low-cost therapy provider in Austin before I moved, and I really enjoyed it. So I was just kind of looking at the different jobs and thinking about kind of what I wanted to do, and that felt right.
Yeah,
The private practice piece.
yeah, and then you went and started it just you in your practice and have gone that route, or do you work with other clinicians in the area, or is it a solo practice?
So back in 2020, I initially joined a group practice in
Okay.
Austin, which was
Yeah.
really nice because, private practice is this whole other world, just from kind of the business side of it, right? And so that was really nice, just having a lot more independence and autonomy in my work, but also still having the support of colleagues, both on the clinical side of things, but then also just kind of the logistical
Yeah.
aspects of private practice. So I did that, and then yeah, it was strange. I think I had one day in the office seeing clients, and then the world shut down. And so
Oh,
then
yeah.
so then I've just been doing remote ever since, and I've had my own practice since the fall of 2021.
Nice. Yeah, nice and not nice, right?
Yeah,
It
yeah.
thrusted, I think, a lot of us in that direction. At the time when the pandemic hit, I was living in Costa Mesa, which is like Newport Beach, California, and I'm used to, you drive down PCH, and it doesn't matter the time of the day, there's always people, and it was like all of those zombie shows you see on TV. It's just empty, quiet. I was like, man, this is
It
the
was so weird.
creepiest. Yeah. And that office was pretty much right on the peninsula, and it was just that mix of creepy but like peaceful. The pandemic is such a weird time.
It was a very strange time. Yes.
But I reflect on this, and I always am curious because we've had a ton of clinicians, obviously, that come on the show that they are in private practice and they were during this time, or just working as a therapist. Being a provider for mental health during that pandemic, did that influence any of the work that you do with anxiety because of how much we saw it during those times? Or because I know you were mentioning you do a lot of work with anxiety and have found some stuff that you're good at that you work with. We saw a ton of that during
Right.
the pandemic. Was that an influence, or were those things you were already interested in?
Yeah, I would say I was already interested, but I did have some clients that It did become, even later on into the pandemic, almost to a phobia level,
Yeah.
really, where it was controlling their lives and causing tremendous distress. So that was useful, thankfully, kind of working, just like with any sort of exposure practice, right?
Right.
That there were legitimate risks, but okay, how can you live your life, right, and do the things you still need and want to do and still practice where it's going to be in a safe enough way for you. So that was really tricky
Yeah.
because it's, then you have to address if you had any of your own anxiety around it,
Yeah.
like, oh, I don't want to go do that, but
Yeah.
either. So yeah, it's interesting.
Yeah, I mean, I imagine you did too, but like with colleagues, it's like we're just as scared as anybody else, especially those first couple months where it was like, what is happening, right? Or like as it started to hit, where it's like, wait, what? This
Yeah.
no, what? And you mentioned a really important word there, and exposure is like I've often reflected it like it's kind of like that 2.5 year period right when it hit to like until it kind of started to settle down. It's like clinicians, therapists, mental health professionals, it's like we were thrusted into now all of a sudden every treatment center and every practice is an exposure practice
Yeah.
because we're going to have to get back out into the world, and we know that there's going to be a lot of people out there who aren't going to quite want to do that. And I think we work with the direct population where that's going to be the case, individuals seeking therapy, which really kind of just highlights that that's really everybody, because we all benefit from it. But yeah, the world was hesitant to get back out there.
Yes,
Yeah.
for sure.
You know,
So,
and we walked with them, didn't we?
yes.
I had this one workbook. It was just a straight up CBT anxiety workbook, and it was like our text with at least 15 of my clients. We'd go through it every week, to check the thoughts, the intrusive thoughts, what's real, what's actually being said, what's happening, what can you do today?
Yes, right. So important, and really focusing on that relationship with one's thoughts, right? Particularly if people are really struggling with worry or kind of stuck in this rumination.
Yeah.
So I like to kind of really focus on that, and again, be able to be an observer of your own internal process without buying into it necessarily, right? If it doesn't make sense to, which we know most of the time with anxiety,
Yeah.
it really doesn't.
We
Yeah.
can come up with all kinds of
Right.
worst case scenarios. Cognitive behavioral therapy, you and I know, is a very popular one. Not only do a lot of therapists use it, but I think it's also, in my estimation, it's a lot of time people's first touch with homework assignments
Sure.
and therapy and things of that nature, or coping skills in general. Like when they Google, they're running into CBT. But one of the words you mentioned that I think is an important one, that I would be curious if you could define for everybody in your own way, not that we need the exact definition,
I'll
just in your
try.
own words, but is a popular one is rumination. It's one of those popular buzzwords. I think it's important on a platform like this we clarify some of these things, especially with clinicians that we know we can trust in the community, so that they have an access to, like, well, here's how a therapist would briefly talk about it.
Sure. And I have seen, even in looking at different therapy texts, it's
Yeah.
described differently. To me, it's kind of the repeated going over, analyzing, focusing on any sort of material that causes distress. So, that may be something that's happened in the past, in the distant past, in the recent past, that just continuing to try to figure something out that oftentimes can't even be figured out, but just it's that constant kind of repetitive replay, and it's also importantly not getting the person anywhere.
Yeah.
So it's not like one of those, oh, well, I really reflected on this, I thought it through, I was able to come to this conclusion about it and move on with my life. That's not what that is. It's just someone spinning their wheels, essentially.
Yeah.
To me, that's how I would describe
Yeah,
it.
I would very similarly
Yeah.
describe it that way, and yeah, it's kind of like I'll hold it up for clients in this sense of like, look, here we are, 2 months later. Have we made any movement towards, let's say, whether it's the stated goal or the chief complaint? Have we made any motion, right?
Mm-hmm.
And if the answer to that is no, but you're still sharing all these ideas, all
Right.
these thoughts, all these images about it, that's ruminating, right? Amongst many other things that we can help deconstruct, but sometimes that intervention alone can help to break the rumination of like, oh, okay, now I see. Because I think that's a lot of times, and maybe in your estimation too, in the realms of anxiety, that's how a client finds their way into therapy, is like it's been presented to them that they're in that pattern of like overthinking all these things and then a consequence, right? And then letting it cool off, but now they're overthinking all these things and then a
Right.
consequence.
Right.
Yeah. And like, what's going on here? I thought I had the answers, only to find that, hey, we may not either as a therapist, but we can help slow it down and deconstruct it a little bit.
Yeah, no, exactly. Yeah, sometimes too, working with people, I have to catch myself. It's like, okay, am I getting into the realm of trying to figure this out with you when we've already, like you were saying, been over it, And so, yeah, sometimes I kind of laugh at it. It's like, okay, wait, I have to stop myself here.
Yeah, yeah. One of my go-tos is, let me stop and state that better.
Yeah.
That's one of my go-tos when I know
good.
in my mind I'm like, I'm getting lost in the weeds here. Yeah, we're human
Yeah,
too.
of course.
But I asked too because it cracks me up. One of my clients, that's one of his favorite words, and he misuses it, and we always crack up because we've been working together for years. And I remember in the beginning, I'd be like, well, maybe not necessarily best use of that word. Why don't we actually come to calling it when we're spinning? And we tried to find other words.
Sure.
But that was his favorite word, and we crack up about it now. Like he loved the word rumination, and I think we all find those kind of things in life where it's like, I just really like using that word.
Yeah.
That was his.
Yeah.
Well, we learn the darndest things about people in
We
therapy,
do,
don't we?
certainly, yes.
Yeah. So what's kind of the progression of the career? Do you see any kind of changes, lofty goals, directions you want to take your practice?
Right now I'm just kind of on my path. One of the things that did draw me to doing private practice is I've always wanted to do direct work with people. So, at certain times, as you want to do kind of a more administrative or, supervisor type role, and I've never really been interested in that. So what I kind of like about doing private practice as well is that, I get to continually kind of hone the craft, if
Yeah.
you will, and continually learn. And so, the more every client you have, you learn so much, and see what they bring and gain better understanding of what works, what doesn't work. And it can be kind of overwhelming because there is so
Sure.
much out there, but yeah, so just kind of continuing on that. I mean, eventually I might like to do some more training in like metacognitive therapy or ACT or ACT, more formally. Possibly in treating like hoarding disorder, get some more training in that. So there's certainly areas of interest I have that I would like to become more formally trained in, I suppose.
Yeah.
Yeah.
Yeah. Would you go in the homes if you were going to get trained and work with hoarding and
I
get
think
involved
so.
in it?
Yeah, my first job out of school was working for community mental health for an assertive community treatment team, and so we went and saw clients in their homes, and there are challenges with that, but in a
Sure.
way you get tons of information, right?
Oh yeah, the
Like,
collateral is, that
Yeah.
extra info when you see the environment someone lives in is
Yes.
very helpful therapeutically.
Yes.
That's another aspect of why I've enjoyed some of the virtual work. You know, there's aspects I really appreciate about working in person with people. But the virtual work, like I get to see, like I have this one client where we'll come kind of back around and always processing a little bit of like, are you can clean up your room or, you know, I mean, these things come up where
Yeah.
like if I just worked with him in person, it may take a while to get to that subtle detail as to like why his mind is cluttered at times.
That's true.
It's such a
Yeah.
small nuanced detail where once you clean it up, it's like, okay, cool, right? That's off the plate. But if I can't see it and you're not telling me about it, I may never know.
Exactly.
Yeah.
Right. So yeah, so I think that would be, I know doing private practice, we don't, I guess like you're saying, yeah, we do get a view into someone's home environment. But yeah, I liked being out in the community and getting to see people in their homes.
Yeah, you were willing to get doors slammed in your face with environmentalist stuff, and you just kept going for it.
I just, yeah, just
I've
kept
got
going
a lot
for
of
it.
respect for that. Yeah,
Yeah, it was some interesting times for sure.
yeah, I did door-to-door sales with different things when I was younger, like who hasn't sold Cutco knives and those kind of things. No stranger to having a door slammed in my face, but yeah, anybody who's willing to get out there for any cause or for any job, especially this day and age, that's a kind of a dying art.
Yeah,
Yeah.
it is. So yeah, I try to remember that and always be nice to the people that, you know, you see
Uh-huh.
out at the
Yeah.
grocery store or
Uh-huh.
wherever, kind of doing the same thing.
Yeah, we were buying Tic Tacs for my significant other's kids the other day with the groceries, and they were like super excited, climbing up on the conveyor belt, and we were trying to get them down. And the lady who's scanning was like, you know, telling them to get down, and then got like real short about it. And we crack up because, well, we live in the community. We go to this Kroger a lot, and this same lady is always, she's very nice, but she gets real short, you know. And we just remind ourselves, like, how important is it?
Right.
You know, it's really not that important. They're a service worker. It'd be we would make it way bigger of a deal if we were like, hey, you know, it's like, whatever. They shouldn't be climbing up there anyway. Yeah.
Yes.
Yeah, we just move on with our lives. But
Yeah, no, that is good to remember for sure. And of course, even as therapists, we forget, right?
Oh,
But
yeah.
it's like you don't know what's been going on in someone's day and their past. So
Yeah.
if you're like, hey, this person's a huge jerk, you know, it might be kind of your gut reaction, but what
Yeah.
actually has happened to them, you know?
Right. Yeah, it's touchy. You certainly don't want to get into that conversation at the grocery store.
No,
in
probably
line.
not.
I used to use that one in group therapy of like, you know, when someone at the grocery store and you're checking out asks you how your day is, they want you to say good and then get the fuck out of the way. You know? Because the person behind you wants to go home. The person working there wants their shift to end.
Yes.
They don't want to know how bad your day was or how
Right.
bad your life is. It's not that they don't care about you as a person. It's that they have their life too.
Exactly.
And I think
yeah.
that's it was always such a useful bridge for things like boundaries and not dumping out information that people aren't asking for. And it's that containment, like that you were touching on earlier, of like helping people get grounded before you do the trauma work. This is kind of the realm we're talking about.
Yes.
Right? We've got to dip our toes in and then learn to swim.
Right, right. Yeah, someone, yeah, coming in first session, yeah, take me, you know, I kind of use the example. I think actually I took it from a client. It's like these suitcases have been down in the basement a long time. So yeah, it's going to take some preparation
Yeah.
to get ready to kind of bring them out.
Yeah.
Yeah.
What would you say to somebody who maybe just stumbles across our conversation? They've never been to therapy, and you have kind of 30 seconds to give them an imparted message on what you would hope that they got out of hearing what you have to say about therapy that might bring them in to give it a try.
Yeah, I would say, you know, if you're having any sort of struggle, to keep an open mind with it. And if you're considering it at all, to give it a chance. And also, I always like to let people know, you know, just because if it's not a good fit, you know, with any therapist, myself included, there are tons of us out there.
Yeah.
So that's really important to not give up and to know that, yeah, there are lots of resources out there and people who could be a good fit to work with you.
Yeah. Yeah. That I remember when I was asked that, this was for like marketing purposes too, of like when someone comes to your website, what do you hope that they see? Or if
Yeah.
they've never thought about therapy before, is like, therapy is for you, and that's cool.
Yeah.
You know?
Yeah, that was a briefer. I like that.
No,
Yeah,
well,
I'll take
I
yours.
loved your
Yeah.
answer too. It's like, yeah, it's that vein that we all, I think as therapists, we know and we try over and over to like relay to society that has a huge stigma around it. But I'm glad that week after week we show up here to have these conversations, and we've had just so many different types of therapists too, which is always really encouraging, because like you were saying, there's so many of us, and each one of us has our own approach. We're just human too. We just so happen to have read a ton of books, and that's really it, and we're going to
Pretty
help you
much,
sort
yeah.
some things out.
Yeah, exactly. Yeah. And my other point, and this is on one of my blurbs somewhere, it's never too early or too late. Because I think sometimes, especially the too late, people like, I've always been this way, it's been this way for years.
Yeah.
And no, just you can, even if you're 90 years old, seriously, there's still a chance for change and healing.
Yeah, yeah, it's why you'll see job listings for social workers and therapists to come into retirement homes.
Yes, exactly, right.
A lot of end of stage
Oh,
life
yeah.
stuff that needs to be sorted. Lots of guilt, which is, I think, reasonable. You get to the end of your life, and while you're confronted by all the things that you wanted to do and didn't do, or vice versa, did do and didn't like that you did.
Yeah, no, it's a lot to sort through for sure.
Yeah. Yeah, and like you're saying, just echoing what I hear you share as well, is we need that support.
Yes,
No
all of
matter
us.
what age. Until
No
that
matter
last
what
breath.
age. Yeah. Yeah, the younger you can start, probably the better, right? Just to get it going. But yeah, but certainly, and then like your point, yeah, different stages of life, it looks different. So, but yeah, we all need somebody we can talk to and feel safe with and have that space. That's the thing too. That's nice. That space is just for you. That
Yeah.
is your time, nobody else's, and just that in and of itself, it can be extremely beneficial. And sometimes, right? Sadly, people are like, I really don't have anybody or very many people I can even talk to or
Yeah.
talk to about these things. So
Yeah. Do you have any kind of like insights on hallmarks to look out for in realizing that there may not be a lot of people around you to talk to, other than the obvious of like you're isolated in a room by yourself? Like, what are some of the things that may dawn on you realizing that you don't have a lot of people to talk to about serious or distressing things?
yeah, that's a good question. I mean, I guess just if you have something on your mind or feel like you would want to talk about something, but then when you're kind of going through your contacts, however large or small, right? Sometimes people can have a lot of kind of shallower relationships. But yeah, so if it's like, ooh, I wouldn't feel comfortable really talking with anyone about this, or maybe I would, but only the very curated version, for example, of what's going on,
Yeah.
then I would say, yeah, maybe something to think about.
Yeah. Yeah. That's one of the ones I use, is like, if you have to clean it up at all, then that's probably not the person to explore
Yeah.
the genuine support you'll need in that. And that doesn't mean that you need a laundry list of those people. Typically,
No.
you need, well, I would argue it's like you need a professional of some kind, which could be very helpful. You need some kind of friendship or relational support. You may want, but may not have access to, some kind of relational, like intimacy support.
Sure.
And then if you're really lucky, maybe like a family member who has the lived experience where you've already cultivated the conversation. But if you're in it and you haven't, that can be really threatening. So it's like you really are leaning towards the side of like free community support or a professional. And I think that's the vast majority of society with a lot of the most distressing things in life, because, well, we live in a society where we're going to clean it up before we share, because we
Yeah.
want to be viewed in the best light
Right.
possible.
Right. Yeah. No. So again, yeah, having where you can just lay it out there, right? And like recovery communities, that's huge, right? That give that space for people. And it's free, right?
Yeah.
So that's also really important. And,
Yeah.
you know, a downside of therapy is that it generally isn't totally free,
Right.
but there are, you know, lower cost options out there too. So,
Yeah.
you know,
And in your practice, are you accepting insurance as well?
I
And-
do accept insurance, and I do have a sliding scale that I offer. So I try to do my best, you know, to work with clients to figure something out that works. Or if it doesn't work, then okay, let's try to find, you know, something else in the community that's more accessible,
Yeah. Yeah.
because that's important.
Absolutely. Those listening along, you can find Julie Barksdale on Psychology Today.
I'm
It
on
was-
Psychology Today.
It's very easy to find you. That's how I
Okay.
invited you onto
All
the show.
right, that's good.
But do you also have a website that you could share for those who might be interested? In
I
what you're sharing
do.
too?
It's juliebarksdaletherapy.com.
Perfect.
Yeah.
Yeah. When we update this on YouTube, I'll make sure that
Okay.
we have that in the bio for anybody who ever stumbles across it.
Okay, wonderful.
And that also links to all our socials as well. I have two more questions for
Sure.
you. The first one is one that I front loaded you on, but if we were going to build a mental health amusement park and you got to build a ride there, what would it be? What would it do? What would you call it?
Oh gosh. Well, I thought about this a little bit, so I guess I cheated a little bit, but this may have been brought up before and it's kind of basic, but I was thinking of just like a baby animal petting zoo farm because to me, like, well, maybe not everybody, but the majority of people, like, who doesn't like baby animals, right?
Yeah.
And so to kind of get the warm fuzzies, just getting to go and spend some time and play with the animals,
Yeah.
it's hard to feel as bad,
Yeah,
I
yeah.
think,
Would these
when
be
you're in.
farm animals?
Yeah, you know, I hadn't thought quite that far ahead, but yeah, I would say a mix. Anybody that'll get along together in the
Okay.
animal kingdom, I guess. Just bring them on in.
Yeah, it could be
and-
exotic. It just is.
Yeah.
Anyone that's not going to eat a child. Right?
Yes, yes. Make sure it's safe, of course, so there's no actual physical danger, but I don't know, fuzzy farm maybe.
I like
I'm
that.
just pulling this out, so
Yeah. No, I dig it. And by the way, you're the first ever
Am I?
to go that route. Yeah.
okay. Well, because my thing is like sometimes theme parks, by the nature of their being, might be really anxiety provoking.
Sure.
So it's kind of work to go. So that's why I was like, what's something that's kind of nice and soothing and
Yeah.
relaxing? Of course, some people love, you know, thrill rides and stuff too.
Yeah,
so
we
there's
get
a
quite
whole
a
mix.
We
yeah.
get quite a mix. You know,
Yeah.
there's the therapists who do get anxious in those settings,
Uh-huh.
and they lean more towards these types of answers as well, of like the soothing stuff.
Mm-hmm.
And then there's the ones that are like, we're going to go up and down and up and down and up and down. On that
It's all
note,
good.
any last words that you have while we have a captive audience that you would like to impart to them?
I just thank you for having me on the show and thank you for listening and watching. I really appreciate it.
Absolutely. Ladies and gentlemen, Julie Barksdale, licensed clinical social worker. We break the cycle here every Friday night at 7 p.m. Central Standard Time. We will see you next week with another guest. Take care.